Glucosamine is commonly used to treat arthritis, specifically osteoarthritis. It can be found in some herbal or dietary supplement products, but it's important to check with your pharmacist to ensure the brand you use is safe. The FDA has not reviewed this product for safety or effectiveness, so it's best to consult your doctor or pharmacist for more details. When taking Optiflex-G, the recommended daily dosage and optimal timing can vary depending on individual needs, so it's important to follow the guidance of a healthcare professional. When taking Optiflex-G, it's important to follow the directions on the product package. If you have any questions, it's best to consult with your doctor or pharmacist. If you are taking the powder form, make sure to mix it thoroughly in the recommended amount of liquid and drink it all immediately. It's important not to prepare the mixture in advance for future use. It may take 4 to 8 weeks for Optiflex-G to start working. If your condition persists or worsens, it's important to inform your doctor. And if you suspect a serious medical issue, seek medical help immediately. If you experience diarrhea, constipation, nausea, vomiting, or heartburn while taking Optiflex-G, let your doctor know. Your doctor has determined that the benefits of this medication outweigh the potential side effects. Most people do not experience serious side effects when taking Optiflex-G. However, seek medical help immediately if you have symptoms of a serious allergic reaction, such as rash, itching, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088, and if you are in Canada, you can report them to Health Canada at 1-866-234-2345. Before taking Optiflex-G, make sure to inform your doctor or pharmacist about any allergies you may have, especially to shellfish, as this product may contain inactive ingredients that can cause allergic reactions. If you have diabetes, asthma, liver disease, or phenylketonuria, PKU, it's important to consult your doctor or pharmacist before using Optiflex-G, as the liquid form of this product may contain sugar, aspartame, and/or alcohol. If you are pregnant or breastfeeding, be sure to consult your doctor before using this medication. As always, talk to your doctor or pharmacist for more details and to ensure the safe use of Optiflex-G. When taking Optiflex-G, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and over-the-counter medications, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Optiflex-G include certain chemotherapy drugs such as tenofovir and doxorubicin. Be sure to discuss any concerns or potential interactions with your healthcare provider. If someone has taken too much Optiflex-G and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the US, residents can contact their local poison control center at 1-800-222-1222, while Canadian residents can reach out to a provincial poison control center. Make sure to attend all your scheduled medical and laboratory appointments. This will help your healthcare provider to monitor your progress and make any necessary adjustments to your treatment plan. If you forget to take a dose of Optiflex-G, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Do not take a double dose to make up for the missed one. Be sure to check the storage information on the package and ask your pharmacist if you have any questions. Keep Optiflex-G and other medications out of reach of children and pets. Do not dispose of the medication by flushing it down the toilet or pouring it into a drain unless instructed. Properly discard the product when it is expired or no longer needed, and consult with your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.